Hi, Redmond. My name is Gray Johnson. I live in North Carolina. For the last 6 years, I've worked in MAT, medication assisted treatment, in two different organizations, and just read your discussion board and just wanted to make a few comments. While I totally agree with almost everything that you've said, and I think the key to what you're saying is that treatment can't be established and operate in a vacuum with medication alone. Um, the reason why I wanted to comment on yours is that unfortunately in North Carolina we do have programs that do just that. They only provide buprenorphine as prescribed by doctors. Now in North Carolina, a family physician, if they've had some special training, can provide buprenorphine for up to 100 patients. Um, but treatment centers typically have at least a CSAC or a licensed clinical addiction specialist to do exactly what you recommend, which is to provide that counseling. Um, what I wanted to say was some of those counseling components are sketchy. Um, you know, these businesses, and that's what they are, their businesses are money driven, and sometimes the outcomes of getting people quote unquote better is not really the outcome of what the company wants. So it's unfortunate that while you would think that medication assisted treatment would focus on the medication and the counseling, one without the other, that's not always the case. The way our programs work here, and I'm not sure where you're from, I'd like to know, maybe we could touch base, but uh, the medication is $12 and everything else is comes with the $12 payment at 12. Some places are 14, um, which is ironic. Folks kind of pop in, they try to tell you that they're doing fine and they don't really want to talk about any of their major issues. Buprenorphine as a standalone is a stabilization med. I mean, somebody can start buprenorphine, become stabilized, and wean themselves down without ever having 1 minute of counseling. And I've seen people do that and do it somewhat moderately successfully. Now, of course, the rate of relapse is going to be much higher, and the length of treatment is going to be much longer. But it can happen. But you're right. Absolutely, counseling, dealing with that anxiety and depression is key. I also work on a crisis team right now, and for those folks that want detox, who are usually at the beginning of their treatment stage, if you want to think about the model of where they're at, they're usually in the contemplation stage of treatment. They don't recognize that buprenorphine and counseling can be most effective. But anyway, just my 2 cents. I appreciate what you posted. Hope you have a good night, and we'll chat soon. Thanks.